Welcome to this session, 27 Nursing Specialties Attorneys Need to Win Cases. In this program, I'm going to discuss the nursing specialties that grab attorneys' attention every time, how certified legal nurse consultants use their nursing experience to consult on a variety of medical-related cases, what nursing specialties medical malpractice, personal injury, products liability, toxic tort, workers' compensation, and criminal attorneys need. Now, before I get into actual specialties that attorneys need, I want to talk first about what is the distinction between the certified legal nurse consultant and the attorney. When you walk into the attorney's office, what knowledge do you bring to the table that the attorney doesn't possess? Knowledge of what? Nursing, medicine, the healthcare system, and how to navigate through that system. Anyone can be trained to read words in a chart. Attorneys certainly can, especially these trial attorneys that we work with. They're very intelligent. But despite their intelligence, they don't have what you have. They haven't worked in the ICU. They haven't worked in the OR, the psych unit, the long-term care facility. Analyzing these complex medical-related cases requires experience. It's not just about reading words in a medical chart. So we talked about what experience you bring to the table. What does the attorney bring to the table? Knowledge of the laws in their state, knowledge of the legal system, and how to navigate that legal system. So you're the expert on nursing. The attorney is the expert on the law. And you're not there to give that lawyer legal advice. That attorney is hiring you for your nursing experience. I have a law license, but I don't give legal opinions. So I wouldn't even want to work with a medical malpractice attorney if that attorney needed my legal opinion. Everything that I'm going to talk about here today applies whether you're consulting with a plaintiff attorney who represents the injured party or the defense attorney who represents the individuals or the companies being sued. And again, I want to stress that the C&C certification program is not teaching you how to be a registered nurse. You already know how to do that, right? The program is teaching you how to take your experience and your specialty and how to use that to analyze medical-related cases for attorneys. So we're going to talk about a variety of different types of cases that attorneys deal with. We're going to address medical malpractice. We're going to talk about personal injury, products liability, toxic tort, workers' comp, and criminal cases. And what specialties within these categories do attorneys actually need? So let's start with the medical and nursing malpractice cases. Now, these are those cases that involve the professional negligence of a healthcare provider, such as an RN, an MD, or an ancillary discipline, let's say a physical therapist. It can also involve the negligence of a healthcare facility, a hospital, a managed care organization, a clinic. Every specialty of nursing and medicine is at risk for medical malpractice. There is no shortage of medical malpractice cases out there. Now, as I go through the specialties that medical malpractice attorneys need, I want you to, as I'm talking, just think through your own specialty, right? And all the things that can and have gone wrong. One specialty that attorneys definitely need are nurses who have air transport experience. This is a unique specialty, and so the average nurse, let's say working in a hospital, really doesn't understand the protocols and the standards for air transport. Some of the issues we see within air transport include stabilization during the transport. Another issue is the status of the patient at the transporting facility, in transport, and upon arrival at the receiving facility, which is often in dispute. So a lot of times there's disagreement about what was the patient's status at these different stages, right? And so you can definitely help an attorney assess that. Anesthesia, another important specialty. Now, we definitely have fewer anesthesia errors today, but when negligence does occur, sometimes the result can be quite catastrophic. Common issues that you see within anesthesia include defective equipment, wrong dosage of anesthesia, and failure to monitor the patient's response to the anesthesia. Cardiology. a very important specialty. One of the most common cases that we see in cardiology is the failure to timely diagnose and treat MI. Other types of cases include pulmonary embolism, aortic dissection, and interventional cardiology complications, for example, arterial laceration. Now, another important specialty is case management and rehab. So if we have someone who's catastrophically injured, and this could be any type of case, not just med-mal, it could be a personal injury case where somebody's injured from an auto accident. If you have someone catastrophically injured, that attorney is going to request a life care plan. A life care plan is exactly what it suggests. It's a care plan for life, right? In other words, for as long as that person is going to need care from their injury. And so basically what this life care plan does is project the future healthcare needs and costs. So nursing, medical, and ancillary care, equipment and supplies, changes in the home environment that might be needed. A life care plan can apply to and does apply to any type of case where someone is injured and is going to need future care. Corrections, very unique environment. And so if we have a corrections medical malpractice case, which could be any type of medical malpractice, right? If we have a corrections case, then basically there's going to be a demand for an RN who has that corrections experience. Critical care. In critical care, very little stands between the critical care nurse and that patient. Very fast-paced environment. Seconds are making the difference between life and death. Big issues in critical care are misdiagnosis of a severe medical condition. In fact, I recently read that as many as 25% of medical conditions go misdiagnosed in the critical care units. And so if something is not diagnosed, then obviously it doesn't get treated. So that failure to timely treat could be another issue. There can also be ventilator support issues and stabilization issues. Emergency, a huge area of litigation. We're talking about a fast-paced environment, an environment where very little is known about that patient who presents, and we're dealing with an anonymous staff, so to speak. So now the plaintiff, if they have to decide, do I want to file a lawsuit because I've been injured, they're suing a faceless defendant. That is a lot easier to do than to have to sue a family provider that they've gone to for the previous 10 years. Big issues in emergency include triage issues, delay issues like delaying in treatment. Many of us have heard these horror stories of somebody sitting in an emergency department for 36 hours, premature discharge issues, and misdiagnosis issues. So when you think about it, there can be misdiagnosis of MI, of stroke, of aneurysm, of appendicitis, of fracture, a variety of misdiagnosis opportunities in the emergency department. Another important specialty is gastroenterology, and here we see issues of endoscopic complications, failing to diagnose colon cancer, and perforation of colon. Home health. Now, patients are discharged from hospitals earlier than before, and so this means they arrive home sicker. Two big issues in home health are failing to seek medical intervention when indicated. So, for example, an RN does not follow through with the patient's issue and seek medical attention on behalf of that patient, or failing to hospitalize when indicated. Hospice. Now, negligence claims are complex in hospice cases because here you have a patient who's at end of life. And so damages in these cases are going to be limited. Hospice cases, for the most part, we're only going to see these cases if we have a compelling issue. For example, an abuse issue where there will be some significant damages. Infectious disease. What a different world we live in, don't we? Before COVID-19, infections in hospitals were already at an all-time high, complicated by superbugs. Now, add COVID-19 on top of that infectious epidemic, and the climate is ripe for medical malpractice cases that are alleging things such as failing to prevent infection or failing to timely diagnose and treat infection. If you're a CLMC consultant, I invite you to take the 3-hour course on the role of the certified legal nurse consultant in COVID-19 cases. We already have certified legal nurse consultants that are involved in these cases. Long-term care, a huge area of litigation. We're already seeing a significant number of COVID-19 cases. We see abuse issues, pressure injuries, falls, and in these cases, we also see failing to timely obtain medical intervention on behalf of a patient. Another significant specialty is management and administration. So if you're in management and administration, you're able to assess issues such as inappropriate staffing, inappropriate delegation, or a failure to adequately supervise a registered nurse, right? Or even someone below that registered nurse. Now, I think most nurses would agree that management can affect patient outcome as much and even sometimes more than the individual provider at the bedside. And frankly, the plaintiff attorney doesn't really want the case to be about an isolated incident or about a nice RN at the bedside. They want that case to be about a profit-oriented institution that's making economic decisions which are impacting patient outcome. Med-surg, fantastic specialty. You're a generalist. You can review a variety of cases. A common area of litigation in med-surg are medication errors. Another specialty is neonatal. Every obstetrical brain-injured baby case necessitates an in-depth analysis of those first 24 hours of life and whether there was exacerbation of birth injuries during those first 24 hours. So for example, in the NICU, is there a failure to timely respond to respiratory distress, which further exacerbated the already existing birth injuries? Additional neonatal issues include neonatal hypoglycemia and jaundice mismanagement. Neurology is another significant specialty. Common cases we see involve strokes and brain injury. Neurosurgery. Neurosurgeons are high risk for litigation, especially with regard to spinal surgery. Also, you can see brain surgery cases as well. OBGYN cases. These cases, the damages are often catastrophic and long-term, and so they can be quite compelling. Example, hypoxic ischemic encephalopathy resulting in brain injury. And this is from, let's say, failure to diagnose and treat fetal stress. That would be considered a very high damage case, and it would be quite compelling. Other issues in OB that we see, maternal death cases, mismanagement of preterm labor, mismanagement of high-risk pregnancy, and brachial plexus injury. Now, within gynecology, we see breast cancer, uterine, and ovarian cancer cases. Oncology. Oncology, there are so many subspecialties, right? So you can't necessarily say an oncology nurse is an oncology nurse is an oncology nurse. But one of the common themes in most oncology cases in the litigation world is that whatever type of oncology case it is, there was an issue of failing to timely diagnose and treat the cancer. Orthopedics, a really important specialty. Anytime someone has surgery, let's say of their spine, their hip, or their knee, and the outcome is less than optimal, they're probably going to strongly be considering to sue. PACU, this is a very unique environment. The average med-surg nurse can't really review a PACU case and get all the subtleties of that case. One of the most common issues that we see with PACU cases is the failure to identify those immediate post-op complications. Pediatrics. Children are not small adults. They have their own unique needs. And so if we have a pediatric case, we really need a pediatric nurse who's going to be able to look at that case because they have experience with those issues. And within pediatrics, again, there's subspecialties of pediatrics, so many specialties can apply to the pediatric world. We also see school nursing cases. Plastic surgery. In the world of Instagram, if someone decides I'm going to have plastic surgery, they expect to come out looking better, not worse. If they get a bad result, there's going to be a high probability that they're going to sue. The kinds of issues we see with plastic surgery cases include nerve or tissue damage, disfigurement or scarring, and infections. Psychiatry. This is another big area of litigation. We see suicide cases, misdiagnosis of a psychiatric disorder, inappropriate treatment of a psychiatric disorder, and we also have seen cases with inappropriate use of pharmaceutical restraints or of physical restraints. Pulmonary medicine. In this specialty, we see failure to timely diagnose lung cancer, failure to timely diagnose and treat lung infections, and complications from interventional procedures such as bronchoscopy. Surgical cases, big area of litigation, a lot of surgery, a lot of different types of surgeries. If someone has a catastrophic result, there's a high probability of a lawsuit. We also see cases involving wrong site surgery, retention of surgical objects, damage to internal organs, nerve damage, post-op infection, and cases related to robotic surgery, especially if there's lack of training and experience on robotic surgery. Urology. In urology, we might see failure to diagnose prostate cancer, failure to diagnose bladder cancer, also kidney and testicular cancer. And in urology, we might see surgical mishaps. We've talked about 27 specialties. Now, what does a certified legal nurse consultant do when a case is not within their specialty? Once you're certified, you're automatically a member of the National Alliance of Certified Legal Nurse Consultants, and you will have access to thousands of other certified legal nurse consultants. So if you're working with an attorney and you get a case outside of your specialty, you are in a very strong position to subcontract with another CLNC consultant. The certification program, there's a whole section on subcontracting in the business development module. So you'll definitely be learning how to subcontract, what to pay for subcontractors, how to charge for subcontractors. We've talked about 27 specialties that attorneys need. Let's talk about the career paths that RNs take and how different career paths can benefit the attorneys a little differently. So, for example, you're working clinically. Well, one big advantage to the attorney is you're tuned into the real world. Your knowledge is real, it's not theoretical. You're in those trenches 24/7. If you're in administration, you really understand the inner workings of the healthcare system. You see a bigger picture that the average bedside nurse does not see. So you can comment on how those administrative decisions, such as staffing and delegation, impacted that patient's outcome. If you're in education, you probably have strong writing skills and strong verbal articulation skills. And this is going to benefit that attorney who ultimately is going to have to take this very complex case and explain it in very simple ways to the jury. So you can definitely help that attorney translate these complex cases to that jury. If you're a nurse practitioner, you're probably very knowledgeable of medicine as well as nursing. That's a real benefit to the attorney. If you have a lot of experience with the electronic medical record, that is going to definitely benefit an attorney in any type of case where the EMR is involved. Attorneys are frankly stumped by the EMR, and in fact, so are some CLNC consultants. So you can unravel these complex medical records in some situations where others might not be able to do so. If you're a risk manager, you have probably reviewed thousands of records in every specialty. So one of the benefits to the attorney is you can analyze any type of case and you can get through those records very rapidly. We talked about medical malpractice cases. Now let's talk about some of the other categories of cases that attorneys litigate and the specialties they need in those different categories. The next category are the general personal injury cases. Now, these cases involve non-professional negligence cases. So, for example, an auto accident or a slip and fall case. Essentially, you can see any type of injury in these personal injury cases. So you might see spinal cord injury, back, neck, head, such as traumatic brain injury, chest injuries, burns, soft tissue injuries, any body part, right? The specialties that attorneys can benefit from include emergency, orthopedics, neurosurgical, critical care, med surg, and burns. The next category are the products liability cases. These are the cases that involve the liability of manufacturers for defective products. I further subdivide these cases into medical device and drug-related cases and non-medical device cases. So with medical devices, examples of products liability cases that we've seen litigated are IVC filters, power morcellators, transvaginal mesh, hip implants. With drugs, we've seen Risperdal, opioids, Fosamax. Non-medical device cases, now pretty much this is anything that a consumer uses, right? It could be defective and cause injury. So for example, machinery and equipment, elevators, children's toys and products, motor vehicles, food, household products, personal care products such as talc powder, industrial products, pesticides and herbicides. One of the big area of litigation right now is Roundup cases. In terms of injuries and products liability, you can see every conceivable type of injury and some injuries that are inconceivable. All you have to do is talk to an emergency department nurse about a list of inconceivable injuries that they see with people using products. Now, how do the specialties apply? Well, if it's a medical device or a drug-related case and you have experience with that device or with that drug, you could be very valuable to an attorney. And obviously, if there's an affected specialty, so if we're talking about a hip implant case and you have experience with hip implants and orthopedics or in surgery, then obviously that would be of value to an attorney. Now, with the non-medical device cases, the specialist that most relates to the injuries, okay? So again, if we're talking about a defective automobile and somebody has back problems, well, then if you have experience with back injuries, you would be of value to that attorney. The next category of cases are the toxic tort and the environmental cases. Now, these are those cases that involve alleged injuries as a result of release of toxins or chemicals into the environment. So you might see a case as a result of waste products from a manufacturing process, hazardous chemicals in the workplace, and lead poisoning cases. The types of injuries we see with toxic tort cases involve cancer and immune deficiency disorders. Specialties of very special interest to attorneys can include a nurse who has any kind of toxicology experience, oncology, med-surg, and strong in research. So if you're strong in research, you can help to get in there to prove or disprove this causal relationship between that toxin or chemical and the injuries that are being alleged. The next category are the workers' compensation and workplace injury cases. These are those job-related injuries or an acquired disease in the workplace. You might see, for example, a workers' compensation case as a result of equipment and machinery injury, or injury from an object striking a worker, or an injury from lifting heavy objects, or injury from an auto accident. Specific types of injuries, again, a wide variety. You can see traumatic injuries, back injuries, cumulative trauma disorders. The common specialties that workers' comp attorneys benefit from include orthopedics, emergency, neuro, med-surg, and critical care. The final category of cases are the criminal cases. All of the cases that we've talked about earlier, medical malpractice, personal injury, products liability, toxic tort, workers' comp, those all fall under civil jurisdiction. Now, criminal cases fall under criminal jurisdiction. So criminal cases are those cases that involve acts that society has deemed contrary to the public good. So many criminal cases involve medical records. Many criminal cases involve physical and/or psychological injuries. Many criminal cases involve issues about the defendant's psychological state. So a certified legal nurse consultant can be involved in a variety of these criminal cases because you're going to be able to analyze these medical records and answer some of these critical issues that these criminal attorneys, both plaintiff and defense, need. You might be involved in violent crime cases. For example, one of our C&C consultants shared that he was involved in a serial killer case. We see driving while under the influence of both alcohol and or drugs. We see child abuse, spouse abuse, elder abuse. And then in the criminal environment, we also see Medicaid, Medicare fraud, and abuse cases. Now, the specialties that criminal attorneys need, any related specialty, right? So anything that's relevant. If it's a violent crime and there's a traumatic injury, a nurse with either emergency or trauma experience. If it's a sexual assault case, a SANE nurse. Emergency nurses obviously are very relevant. Med-surg nurses and psychiatric nurses. So in summary, I've talked about 27 nursing specialties that attorneys need to win their cases. If you believe that you're a good fit for becoming a certified legal nurse consultant, or maybe you just want to explore more, I invite you to contact the Institute. And thank you so much for joining me for this session.